Many people find themselves today struggling with hormone health and they just don't know where to turn. Tired, weak, maybe moody. That's not a great way to go through life. But how do you know if your hormones are off? And if you find that they are, or maybe they're not at optimal, what questions do you ask? Who do you see? How do you take control of your life and partner with your healthcare professionals to get your health back? Today's guest is going to answer all those questions and more. Welcome to the Evolve Podcast. Evolve your body, evolve your mind, evolve your soul, and evolve your tribe. And now it's time to disrupt. And with that, folks, we want to welcome you to another episode of the Evolve Podcast. Lost somewhere in the mountains of Utah, I am your host, Steve Cutler, and we are really fortunate today to be joined by one of the smartest people I know, and truly someone that every single time we have a conversation, I learn not just one thing new, but several things new. Celeste Hicken, thank you so much for coming onto the podcast today.
Thank you. What a good introduction. That's pretty. I got to live up to that now,
You always do. Even when we just see each other in
Thanks.
passing, there's just some sort of bit of knowledge or wisdom or something that you have learned that has just blown my mind. So tell our listeners a little bit about yourself and what you do.
I'm a nurse practitioner, and I started learning about hormones probably about 7 or 8 years ago, and then I started practicing them a little bit more directly in the last 4 years. So, a lot of people, I was family practice. I went to Georgetown and DC. Oh, yes. Woo. Um,
Love it.
um, So what happened is I started to notice that patients were coming in and they were having a lot of symptoms. And we would do these labs, and the labs were dictated by what I was allowed to do in a health insurance model or a hospital model.
Yeah.
So I would do very basic or middle labs, and then what would happen was the symptoms would be there, but normal. We talked about normal. Well, you're within normal range. And when we say that to people, it's kind of deceiving because normal is like a safety range, not necessarily
Right.
optimal of how we want to feel. So that's kind of how I got into hormone therapy and just working with patients. So I did family practice, and then I got more into functional medicine and really like trying to help patients pursue optimal health.
Yeah, I like you bring out the difference between optimal and normal, because if we think about what's normal in America is that I am low energy. I probably go eat out the majority of my meals. I drive everywhere. I don't walk. And if I have a gym membership, I might show up once a month. Like that is normal for America. And so normal is different than optimal. And I think normal, unfortunately, that it's becoming a sliding scale that continues to go downhill, where normal means that we are in more pain, less energy, less energetic, less vibrant. And so I think for any of our listeners who have heard the term normal before when they go to the doctor and they walk out and they think, but I don't feel good. Well, that's probably normal. So we need to discuss
Right.
and take and deconstruct today the difference between normal and optimal. Before we jump into hormone health, though, I want to start with a question that I think might be beneficial for our listeners, because as I mentioned in the introduction, you are one of the most fascinating people that I know to talk to, and you always have new things that you're learning. How do you stay up on top of it all? What does your study research process look like? How is it that you are constantly learning?
I think one of the ways that I learn the most is I train for a bunch of different companies. And in this role, what happens is people ask me questions. And
Mm,
when I don't know the answer, I'm put on the spot of always having to learn.
yeah.
And then for me, patience. Patience drive me to learn because I will meet a unicorn or a panda, and they've gone through so many processes and they've worked with so many different people. And I feel like I want to be able to be a resource to say when I can achieve a goal for them or when I can't, if I need to find another direction. So, what motivates me to pursue knowledge is, you know, the lack of ever feeling like I've learned enough.
Yeah.
There's always a
Great.
caveat and a nuance, even with hormones. They're so much more complicated than ordering something off of Amazon to feel better. They're very complicated, and just trusting them to anyone, it's a great honor when someone trusts me with their hormonal health, right? Because it affects everything in your body. So, also, I'm omnicarnivorous for reading and knowledge.
Yeah.
So
Love that.
I listen to like 5 books a month, and then I'll read with my eyes five. That's kind of my rule.
It's beautiful. Omnicarnivorous. I love that when it comes to reading. And you're certainly a polymath. I mean, you're the type of person where you have developed knowledge and skills and abilities in many different areas. So that doesn't surprise me. I love the thought process of you're taking on the challenges of putting yourself out there to the world, training other people, and then you're also treating people. And with each opportunity that you don't know, that's an opportunity for you to grow. That's a mantra that I've held for years. If I don't know, that's my time to grow. And what a great way to lean into that continual learning. But you also, like you said, you have several things going on. And I know there are times where, like you and I have texted back and forth different audiobooks, and sometimes those are just random fiction books, right? They're not always the I'm learning because I think fiction you can learn as much and from as anything else. Understanding the
Like a
human
good
condition,
sci-fi.
right? Yeah, yeah,
Yeah, a dystopian sci-fi for the
yeah,
social constructs. Yeah.
yeah.
I love I love all types of knowledge and I like to be entertained for sure. But I
Awesome.
can't always watch Netflix because I have to do my whole life.
Yeah,
So
you're
when I'm
busy.
driving or yeah, I like to, but I usually do like a ratio for myself. I can't do all entertaining or all learning. Otherwise I get imbalanced with like how into a subject you get or how motivated or dedicated it can be obsessive. So you have to balance yourself.
I think there's a lot of wisdom to that too. And as we move into talking about hormone health, it's not just one thing. And I think when you're learning, you have to learn a lot of different things in life. You can't just be a one trick pony, and you can't just be a person that says, "This is my specialty and that's it." It's funny. I've been talking to some people recently, and just peeling onion layers back and saying, "Hey, I love doing this podcast. Obviously, we want to continue to see it grow. What's your perspective?" And there's been a common theme where people say, well, Steve, you're not niched it down enough. If you just talked about this one way of exercising, or if you just talked about this one diet, you'd probably grow quicker. And I said, well, I'm going to continue to break that rule then, because I don't want to do that. I've got too many interests, and I'm sure that there are other people out there like me that are going to find some of these things interesting, and they will continue to follow us, which it's working. Maybe we're not growing as fast as what we could if we just talked about eating kale every day. But,
I disagree with that model. I think that's a marketing tactic, but not
yeah,
longevity.
right,
Because
right,
what happens is people are way more complicated than one preference. Even if you think about your podcast listening, I don't listen to any one podcast that's repetitive all the
right,
time. I have
right.
to. I don't like a all the time crime murder. I get a little bored of the same patterns. So I think the diversity really helps people to come back to the model to see if there's something new,
Absolutely.
you know.
And we're
Mhm.
diverse individuals. And I think, as you referenced earlier, there's a diversity, there's a biochemistry inside of us that people do not understand on their own. We don't typically do our own taxes, we don't fix our own cars. We don't look at life and say, I'm going to do all of that on my own. And yet for some reason we think that just because a beautiful bit of marketing popped up telling us that this pill, this supplement is going to help us to get more testosterone, that's the thing we should buy. So much more complexity to hormone health as it relates to overall health. So let's talk a little bit about some signs and some symptoms that would cause somebody to say, hey, I might have an issue and I might need to get my testosterone, my estrogen, my whatever it is that they have heard tested? What are the signs and symptoms that you typically see?
I think that there are some overlap between men and women. So I think that's a good place to start is where they overlap. I think for both men and women, you start to notice a decrease, a lot of, okay, I guess let's do it separate. Men come into me for a decrease in sex drive or ED.
Okay.
Really, really common. Those are the most common. For women, they come in for primarily more like sleeping problems or treatment of hot flashes for
Interesting. Okay.
menopausal symptoms. Yeah. But some of our symptoms can overlap in male and female because they
Mm.
affect the same pathways. And we both have testosterone and estrogen. So
Yep.
that's why there's so much overlap. For men, you'll notice like a reduction in lean muscle mass. So even if you're working out, even if you're eating your kale, even if you're, really dedicated to your body as treating it like your home and how you live in it, um, you are going to notice a decrease in lean muscle mass and what they call a central adiposity,
Mm.
meaning weight that is around the midsections,
Yep.
in addition to visceral fat, which is weight around your organs. So there that shift definitely happens to men in their 40s. This increase in fat and decrease in lean muscle mass, decrease in testosterone can cause depression. It can change your cognition. So they'll
Mm-hmm.
call a brain fog, um, fatigue that you mentioned that a lot of people say they express. And that is so many different things, fatigue. But that's a common kind of little profile of somebody that's coming in saying that they are not feeling well.
So a lot of people, when they talk about that they got their hormones tested, externally they'll say, "Oh, I got it tested because I was tired." So what I'm hearing from you though is once they're in the room and you're hearing the main signs and symptoms for men, there's a decrease in sex drive and erectile dysfunction are probably the two most common amongst some of those others. And then for women, what were those again for women?
Women are going to experience, women also have low sex drive, but it's not their primary concern. They usually will come in for the symptoms of hot flashes. So
Gotcha.
for a lot
Okay.
of people, they don't know what that is. That's like facial flushing, chest flushing, where they just feel extremely hot, and this can happen any time of day.
Mm-hmm.
Nighttime sweating, severe sweating, um, sleep problems, low libido or sex drive, mood changes, maybe partner complaints of mood changes or irritability, and then also that brain fog or cognitive changes. So when people just have a harder time concentrating, that's kind of what women are a lot of times coming in for.
Okay.
And it varies a lot if they come in with their partner, if they come in alone.
In terms of what they tell you or what they're,
Correct.
yeah,
What
okay.
they're willing
Okay.
to disclose and what
Yeah.
their priority is. It's sometimes hard to discern what the person's priority is without their partner because their
Yeah.
partner will speak with them. So that's a big thing that I know it doesn't sound very kind, but I really encourage people to go to their provider the first time by themselves because a lot of times people have a hard time saying how they're feeling
Yeah.
because it affects that sexual component of people's relationships.
Right. Right.
Like being honest about performance, it may affect like the compatibility where someone's feeling not desired. It's really not a desirability, it's a decrease in testosterone, and it's not like it's not a fault of the
Right.
partner. Yeah.
Yeah. It's pretty fascinating. I've heard over the years and worked in a couple of spaces where hormone replacement therapy was administered, and that relational aspect is very, very challenging for different reasons for men and women. But when you talk about the sex drive and or sexual performance, there's a lot of guilt that comes with that for both men and women. I've heard women say, well, I feel guilty because I'm just not as attracted
Interested.
to. I'm not as
Mhm.
interested. And so they feel like that something is wrong with them, or something's wrong with their spouse, or maybe they're just, they've lost the spark, so to speak. And then with men, it's the combination of that sex drive is down, so they don't quote unquote feel like a man, and then maybe performance isn't there, so then that makes them feel even more,
Confidence.
yeah, guilty, that
Yeah,
yeah, they don't have that
it
confidence, right?
really affects their confidence in a cyclical loop, like you're
Yeah,
saying. So that means when someone feels a lack of confidence, then they are not going to engage in it. And not going to engage in it makes the partner feel not desired.
yeah.
And then they defend the behavior by saying, I'm, and they're not even always willing to disclose that they think it's testosterone.
Mm,
And so most of the discussion around testosterone is the sexual component, but we don't really know. Most people don't really know how much it does for your cognitive, your mind.
yeah,
The way you feel about yourself is a lot with that dopamine. So when you have dopamine increase in your body, you have an increase in the ability to produce testosterone.
mm,
So that's one of the things where we know a cognitive change is correlated with depression and fatigue. When you stop working out and you stop moving, your testosterone goes down. So you can see that these things become cyclical. They come together and they kind of break down how you're feeling, and it increases the depression, but it's also the testosterone decrease that decreases your arousal and your ED, right?
yeah,
So then they kind of come together and it just feels a little bit overwhelming. And most people don't know they're correlated.
yeah, yeah. And I think that's an important thing to understand. I mean, sometimes when people have these situations, it's not something you can just talk through with your partner or spouse. Well, communication is extremely important. If the hormones are out of balance, if testosterone is low, and you don't get that testosterone at an optimal level, you're still going to struggle, regardless of the communication. The communication is an important aspect of any relationship, but that's not the tool that's going to fix it. There's more to it, and it's very nuanced and very complex. So I really like how you're talking about that. People when they come in for the first appointment, they should come in just by themselves so that they can be open, talk to the practitioner, their healthcare practitioner, about where they're at, how they feel, and really just lay it out on the table and understand that the healthcare practitioner is there. They have probably seen it all. And so what you're bringing to them is not anything new. And while it might feel a little bit uncomfortable for you, that's okay, because that's the only way we grow, is we step into that, that uncomfortable feeling. What are some
So
other
one other
challenges? Yeah, yeah, go.
thing I think for people to come in with a goal, because a
Oh,
lot
great.
of times it's overwhelming and they don't have direction. So they just come in and they have this thing where they want me to fix them. They're just say, okay, fix me.
Yeah,
And we don't necessarily know what fix means for you, Steve. Could be really different than Bob or Fred or Tim.
right.
Steve may want to fix his depression and brain fog, and
Mm-hmm.
Tim is only interested in his sex drive.
Yep. Yep.
So it's a big deal for people to come in and say, I want hormones. I'm not sure what I know about them, but my goal is I need to have better relationship with my wife. I need more energy. So in general, when I have patients that go to other people or they're going to a specialist or coming to me, I say, for a 30-minute appointment, you want to bring at least one goal, maybe two, no more. And
Yeah.
that way we can achieve the results you're looking for, and I can direct you towards options to maximize your time and mine, for
It's a
sure.
yeah, great point. It really educates the process overall. It reminds me of when I got the last time I got my hormones tested. I did the blood work and I had a goal. My goal was to see if I could optimize and be in that most optimal range so that I could increase my strength and maintain a lean body mass as well. And I was already fairly lean, and I work out consistently, and so there was nothing really wrong. It was just what is possible. And so we did the test. I looked at the results, and after looking at the results and talking it through, I was, I was in a good range, but not optimal range, but I was right below optimal. So I thought, well, okay, let's look at some other factors. Do I really want to do this? Do I really want to take it? Because I had a goal of optimization, I made a choice to not do hormone replacement therapy at that time, and I changed a few lifestyle factors. I was honest with myself and said, "Hey, I'm not going to bed at a normal time. I'm not getting enough sunshine during the day." There were two or three things that I focused on, and so I did those three things for 3 months. Came back, got tested again, and hormones were in an optimal range. And I was very happy with my decision. Not to say that I would never do hormone replacement. If I get into a situation where I feel like that will meet my goals. But to your point, if you don't have a goal, then it makes it really difficult to know whether this is going to be the right thing for you or not. All right, so we've talked about some of the signs and symptoms that people see and feel when they are coming into you. Let's walk through, what does that intake process look like? What are the things that you are asking and or looking for in that initial stage?
So in my intake form, I have them answer questions about symptoms, how long they've been going on, um, diet, exercise, sleep patterns, those kind of
Mm,
things, because there are um, there are certain people that don't want to take exogenous or hormones externally.
yeah,
So that's just fine unless there's some type of dysfunction.
yep,
So there's other medical syndromes that can maybe inhibit your ability to produce certain hormones. And in those cases, with the absence of just getting extra sunshine isn't going to alter your body's ability to have that substance in your body, like
yep,
vitamin D, that kind of
yep,
stuff.
yep,
Um, so I really kind of walk them through the process and have them answer a large number of questions about themselves, their symptoms, their goals, and then kind of what they already know about hormones, because I'm surprised how much misinformation there is, or their friend Betsy referred them, or their brother Ben told them to get on testosterone. And you have people that are really seeking more supplementation for working out, more of the performance enhancement version of hormones.
yeah,
So there's a big distinction on HRT, which is hormone replacement for wellness and optimizing your body function and feeling good, or augmentation. Augmentation is pushing your body past optimal and normal levels into a range where you are in growth, a constant state of growth, for muscle hypertrophy,
yeah,
right?
right.
So for me, I personally don't handle that population. I refer them out if they're looking for performance enhancement,
Because really,
like with,
performance enhancement is essentially, back in the day, and I don't know if people still use this term, but it's just you're using steroids, right? I mean, and
yeah.
because that's all it is it's just
I
another
don't really
way of
have a problem with
enhancing,
it.
right?
Yeah, I don't have
Yeah,
a problem with it. I just don't choose to manage it
right, right.
because because of the risks and the demands on the relationship.
Yep,
So for me,
understandable.
I'm really looking to create wellness in the environment and help people seek balance.
Yeah, I tend to lean on the side just personally where I think hormone replacement therapy to treat issues, to get people to a healthy state is a phenomenal way to go. Um, I've seen and known a lot of people that have done the other side of it, where they're doing it to enhance performance. And I can't say that I'm overly critical of that, because I understand that some people might be in a situation where they feel like that's the thing to do. So I guess I'm not one to judge. Not my preference. Not something, like I mentioned before. When I found that I was in good and not optimal range, I chose not to go that route, because we're literally talking about, do I want to spend the time and take the risk, spend the money and push further just for a physical change that has nothing to do with my health? And I just chose not to. Now, I will
Yeah.
say, when I was in my early 30s, I had a health issue where that caused me, as the way my doctor described it, to just create a cascade of hormonal issues. And so when I got everything tested, you mentioned hot flashes. I was actually in my mid 30s
Mhm.
having hot flashes. And the doctor and I had several conversations back and forth. And she said, look, we need to get you on something. Otherwise, you can do all these other things. You can eat better,
Mhm.
you can get sunshine, you can go to sleep earlier. It's not going to do anything. And so there was probably about a 3 month period of time where I got on hormone replacement therapy. And then at a certain point, something just clicked. My energy was higher, everything felt better. And so we pulled me off of that, and I felt like $1 million. My lifestyle factors were then supporting what I was doing. Now, I just tell these stories not so that somebody looks at this and says, oh, that's what I want to do, but just to say I can relate. I've been where people are at, whether it's on thinking through the performance issue or thinking through the issue of how do I improve my health. So let's talk about some of the misinformation that you just referenced. What are the most common things that you're hearing people talk about when they come in to see you?
There are medical conditions like hypogonadism, where people are not producing, males in particular,
Okay.
um, are not producing enough testosterone. And that means even if they have like undescended testicles, they
Mm,
won't grow to maturity. They won't be able to produce sperm. They will be infertile. So
interesting.
not taking hormones changes their life.
Yeah.
So
Right.
there's medical conditions like you're saying that we run into that I guess a comparison is a type 1 diabetic and a type 2.
Right.
Type 1 diabetes is not having insulin in your body, and type
Mm-hmm.
2 can be behavioral, it can be genetic, and can be insulin resistance from food consumption. There's a lot
Right.
of different variations. One can be supplemented with diet and exercise, but a type 1 diabetic can't, they don't make insulin. They will die without insulin. It's
Yep.
not a choice. So when we talk about certain hormonal conditions, when women hit 51, it's in the US, the average onset of menopause for women is 51 right
Mm,
now.
okay.
So when women hit this age range, perimenopause and menopause, their body stops producing. It stops. It's not like men where there's a vast range of uh, cessation or decline. Some men in their 40s will experience a decline in testosterone, but it's not in the same comparison as menopause, where it actually is a faucet and it turns off intermittently and slowly for about 3 to 4 years, and then it's done. It's totally
Mm-hmm.
done. So, a total cessation of hormones has a lot higher range of side effects for women than it does in men, where men will start to have smaller symptoms and it varies. I'm not a man, so I'm not going to say that. Your symptoms are as big as they feel to you, for
Yeah.
real.
Right.
It
Sure.
doesn't matter who evaluates them. But turning a faucet off is quite different than a slow cessation.
Yeah. Yeah.
So
Different experience.
a lot of a lot of the misinformation around hormones comes from the 90s and 80s, and it was when they were giving synthetic Primpro estrogens and progesterones to women that had some serious side effects. And when people speak of HRT now, primarily they're speaking of bioidentical hormones, which are hormones derived from plants that are not synthetic molecules that can't be patented. So that's what makes them different than a prescription drug that is a synthetic isomer that mimics a molecule that occurs in our body.
So are you
So,
referencing like
so
one of those things that I remember hearing so long ago that has it seemed to continually perpetuate is this idea that if I do hormone replacement therapy, it's going to cause cancer.
yeah. So there are risks involved with any type of supplementation, but a synthetic form of hormone has way more risk than the bioidentical hormone.
Okay.
So before you get that, if you have a history of hormone dependent tumors, meaning that they thrive on hormones,
Mm,
that would be a conversation that you would have with your provider. But it's just not spontaneous combustion that it occurs
gotcha.
in every person as soon as you get on a hormone. You really have to have those receptor sites that will accept a hormone to grow the cancer. Does that make sense?
Yeah. So there's got to be a pre-existing condition
Mm-hmm.
and some sort of affinity towards that you need to be tested for. You need to understand.
Right.
Yep.
And that being said, the synthetic molecule has a much greater effect towards that than the one that's in made in nature, right? The plant
Yeah.
one.
Interesting. What are some of the
I
other
think
misinformation topics that are brought up when that you hear?
I think just doing lifestyle changes for women will fix everything. I think that tends to be like you've mentioned, you're like, oh, if I just get enough sleep, then I'll be okay. But for women that are in menopause, the decrease in progesterone causes insomnia.
Yeah.
So
Yeah.
they can't sleep, and then people are like, well, you need to get enough sleep. Their body is
Thank
actually,
you.
yeah, you're like, well,
that,
thank you.
thank you. It's
Melatonin
very
and
helpful.
progesterone, yeah, thank you. Progesterone is one of the primary components that regulates that sleep cycle for women.
Yeah.
So waking up at about 2 o'clock in the morning all the time really inhibits your body getting into what they call as a deep REM. Now we know that if people don't get in a deep REM, what occurs is they have what they call as phases of your hormones get to peaks at night, right?
Mm-hmm.
Sleeping increases like your decreases your cortisol, and then your cholesterol will bind to different hormones making more of them, right? So like when a person has sleep apnea, when they're waking up in the middle of the night and they don't know, that increases their cortisol and decreases their testosterone
Mm.
so much that even the VA recognizes this and will make people get sleep studies before they
Wow.
put them on testosterone,
Wow.
which I love the VA, but it's not the origin of the most advanced knowledge on how we take care of patients.
Right. Right.
But even when the VA says, hey, we're not putting you on testosterone unless you have a sleep study, it's a big deal. So I think recognizing when there's actually a deficit versus supplementation.
Yeah. So for women in particular, understanding that a misinformation or misunderstanding is that they can't just fix some of these things with
Right.
lifestyle because there is a significant change that is happening inside of the body. And so,
There is zero or no hormone being produced that
yeah,
regulates that circadian rhythm, that
yeah,
regulates the sleep wake cycle. So if you have no water, you're not going to grow any type of plant, right?
yeah,
It's just
doesn't
not
exist.
there.
Right.
And then I think for men, the one thing about supplementation for testosterone is they think that hyper virilized men, meaning tons of testosterone, makes you have a great libido. The problem with that is too much testosterone really decreases your libido.
Oh,
You need an
interesting.
estrogen balance with testosterone to maintain your libido. So
Hmm. Okay.
testosterone is really, really important, but you also need the prolactin that um, that's what causes the refractory period after people have sex, prolactin. And then people supplement with like B6 to reduce the refractory period. So there's a lot of like in-depth thought that people are putting into this on how to maintain wellness as we're living so much longer. If your hormones stop at 50 and if they decline in men at 40, and you're living till 90, you still want the benefits of bone density,
Yep.
heart, sleep, estrogen, like regulation for what is it called? The epithelial cells in your heart,
Yeah.
heart health. It's a really big deal.
That's a pretty fascinating thing to think about the what the average lifespan is today. If people are living even into their 70s and this major change happens in your 50s, you got another 20 years of dealing with this. If you live to your 90s, you got that. I mean, that's what are we sitting at? 35% of your life that you're living,
Uh-huh.
almost 40% of your life that you're living without hormones. And 100 years ago, 200 years ago, 300 years ago, when people were not living as long, this was not an issue. And so I think that, brings up this idea that some of this understanding, some of this research is new and it's ongoing and it's ever changing because we didn't have to look at these things. We didn't even have the technology to look at these things 200-300 years ago, but we also weren't living as long. So I think that's a really important point. Celeste, you mentioned the difference between the faucet turning off for women and the faucet kind of slowly dripping for men. So with women, the menopause; with men, andropause. Talk about what men experience as they go through that.
This is kind of a misnomer. It's not really the same. It's just more of a decline. And the very interesting thing about men is some men actually maintain high levels of testosterone all the way into their 80s. But that's more of an outlier. That's not the bell curve or what
Yeah.
we're talking about as normal. Um, what happens is after about 40, there's a decline in testosterone. The most interesting random decline in testosterone is when you have a baby. So when somebody is partnered with a woman, right, and they'll have a child, men gain weight, and everyone's like, "Oh, they're gaining weight because they're all eating for two." Well, actually, it's a hormonal signal to decrease their testosterone to make
Yeah.
them stop participating in propagation. They're
Right.
supposed to take
Right.
care of this baby. And yeah, so the biggest decrease in testosterone is in their 40s and when they're having children.
Yeah, that's
So
fascinating. I didn't know
yeah,
that, but it
it's
makes
pretty neat.
sense. There's a guy that I used to was a mentor of mine for a lot of years, and he studied a lot of this stuff. And he used to say, the best way to increase testosterone is just change your sex partners frequently. And he goes, that's probably not the best way to live, but that is the best way to increase your testosterone because then it's just going to continually boost. So if you're in a committed relationship and you have kids, testosterone will drop, and there's a biological
It,
reason for
it
that.
does. It does only in the first about 9 months, and they believe it's due to pheromones
Interesting.
because that's the time period in which a baby would be able to walk and the mother would be able to provide and take care of it. So for the gestation
Wow.
period and a short time after, it decreases.
So it's much more of
And
a
your friend's
nurturing.
cute, yeah, your friend's idea about switching partners, really the best way for people to, one of the best ways is breathing to
Mm.
increase your testosterone or
Yeah, I'm not
estrogen.
saying go do what he
Nose
said.
breathing, nose breathing, sleep, they
Yeah.
give you way better boost than sexual partner differentiation. It really just changes the content of the sperm. If you have fighter sperm or swimming sperm,
Talk about the nose
right?
breathing. Why I know there's a lot of benefits about nose breathing. There's several great books out there about breath. Why? What does nose breathing do to testosterone?
So, like I said, the biggest thing that people recognize is sleep apnea or sleeping. And part of that is breathing through their mouth. That
Mm-hmm.
obstructive sleep apnea comes from mouth breathing. Nose breathing regulates the amount of oxygen saturation and pacing.
Mm.
So it doesn't give you buildups of CO2 that change your production of dopamine and cortisol. So that's one of the ways that it works on
Interesting.
that pathway.
Okay.
Yeah, so there's actually like a book, maybe I think it's called Jaws, and it talks about the benefit of breathing through the nose, and it shows you pictures of the aesthetic changes that occur to the face for protrusion of jaw,
Mm-hmm.
atrophy in the masseter, and then change in the distension of the eyes. So not only the aesthetic components, but how it changes the shape of your face and body to mouth breathe. So daytime nose breathing without the extent of eating or talking or exercise. And then nighttime. There's even studies that say like a soft tape, like a paper tape on people's mouths to help them practice this.
Yeah.
Because nighttime nose breathing affects those cycles even more.
So I learned about
Viewing
the
light.
mouth taping. I want to stay on tape or mouth or
Yeah.
breathing for just a second. So learned about the mouth taping a few years ago from a good friend of mine. And I went on Amazon, bought some of that 3M tape, started doing the mouth taping, and I can tell you, out of anything that I've ever done to improve my sleep, that's it. Like that significantly changed so many things in my overall wellness. I would wake up, or I do wake up feeling so much more refreshed. I'm able to breathe better through my nose during the day. When I am in a zone two, even push into a zone three in my cardio, I can still nose breathe. And that's conscious. I practice that. And I
Mm-hmm.
just find that I feel so much better. And you think about if you can get in a zone three and you're still breathing through your nose, your regulation, your catecholamines are not spiking. You're not getting this
Yep.
like highly energetic
The
rush of,
cortisol.
oh
Yeah, yeah.
yeah, the wow, I'm so
Inflammatory response. Uh-huh.
exactly, and you feel phenomenal. When once Danielle and I started nose or mouth taping in bed, we just started to feel better. And then we started to take it a little bit further when we'd go for our walks. And we would focus even more if we're walking or hiking and it gets more difficult to keep our mouth shut and just breathe through the nose. Those two things right there have been, just staggering, the health benefits.
Well, something that really hits on that is weight training. So
Yes.
when you're
Mm-hmm.
doing endurance training, to do that first, to do the high endurance weight training before um, your cardio, that will affect the increase in your testosterone for upwards of 24 to 48 hours.
Oh, wow.
And so
Okay.
this, yeah,
Interesting.
so hit training prior to endurance. This and this is like the UFC. Like you can look up their research in it too.
Okay.
Yeah,
Interesting.
this is actually charted. And when they talk about weight training, they're talking about high intensity, and that
Mm-hmm.
means like 8 reps. You're
Yeah.
looking at like 6 to 8 reps, 75% of your capacity for that.
Now, that's really cool. So I've
So
always programmed strength training
the
first.
opposite.
Yeah,
Mhm.
no,
Oh,
I like
oh,
strength
you
training
do.
first. Yeah, because for a couple of reasons. One, I want your energy to be as high as possible, because I believe preserving muscle has got to be the number one goal, if not building muscle. And if you can have the majority of your energy going towards your strength program, you can slog through any cardio after that. It doesn't matter, right? Whether you're doing low intensity or high intensity, it's going to be, I mean, if you do high intensity, then you're just hitting high with high. But if you're doing low intensity, you're bringing it down to a zone two. Yeah, so I've always programmed that. I found better results with every population, whether you're an athlete or little old lady that's recovering from your hip surgery or whatever it is. I've just found so much better, so many better results physically, from a strength standpoint, hypertrophy, it doesn't matter. Better results with strength training first. So that's really fascinating to hear that it's affecting the hormones in a positive way too.
Yeah. And you want the other thing, there's one other caveat of that is if the endurance training or your cardio is greater than 70 minutes, they say 74 minutes, that's going to decrease your testosterone.
Oh,
So
interesting.
that means
Okay.
like the depending of the intensity of the training, um, that's you increasing your cortisol. So if you're
Mm,
like on a 2, 3 hour hike, depending upon its intensity, that's not going to be the same as you running as fast as you can for an hour. You know
yeah.
what I mean?
Yeah. Wow. Fascinating. Okay.
So, yeah.
Talk about more of these lifestyle factors. I know we've referenced strength, we've referenced light, we've referenced sleep, but there are several lifestyle factors that play into a person's hormone health. And we're obviously not talking about somebody who has perimenopause or been through
Right.
on the other side of menopause. So just the
General
rest of them.
optimization from 20 to 45.
Yeah. So let's talk about
Yeah.
some of those lifestyle
Well,
factors.
actually, the sunlight viewing, we haven't really talked about that, is in the first hour of being awake.
Mm-hmm.
2 to 8 minutes looking at the sun, and not to the point where you're damaging your eyeballs, but that really changes the the sleep cycle for
Yep.
you, that will initiate the melatonin secretion at night, that will help you get your 8 hours of sleep, that help that REM, that increase your dopamine, that increase your testosterone production. So actually 2 to 8 minutes in the morning, the first hour you wake up, viewing a light source.
Now, I've heard, so for somebody like myself who gets up before the sun comes up, that it is beneficial to get as many lights on as you can, but then sometime before 10 o'clock, when the rays of the sun are at a lower angle, to do what you're talking about. So as soon as
Um,
possible, but that's
yep,
sometime
as soon
before the
as
angle
possible.
changes.
But I think it differs on just depending upon who discusses this behavior, the duration and the time. I don't think I've ever seen anything past about 9:30 to
Oh,
10
okay.
o'clock for
Yeah.
light viewing,
Yeah.
just because that 12-hour cycle starts a little bit earlier and you want the melatonin to secrete as the sun goes down, but we're not an agrarian society anymore.
Right.
So our
Right.
light is totally different. So
So if you
probably
can get
within
that
the 12
before nine
hour
o'clock, then
range. Yeah.
yeah.
Yeah. Because if you're going to bed at 9 o'clock or 10, you would want melatonin secretion for 2 to 3 hours prior to that.
Wow. Okay. What about light
Yeah.
at night? What's important at night?
Um, yeah. So bright light in the middle of the night. So this is a huge thing that's changing the way people sleep and how long they're able to sleep. So somebody wakes up in the middle of the night, they can't sleep. So the first thing they do is pull up TikTok or Instagram or,
Got the
yep,
phone right
and
in
put
front of their
bright.
face. Yep.
Exactly. So too much light in your eyes, um, this will decrease your dopamine production. And there is a lot of studies on this, especially the way this is affecting kids' brains and
Mm.
kids' sleep cycles. So that actually, you can look up that study in Cell and Neuron, and it'll show
Okay.
you really past 10 o'clock, you shouldn't be viewing bright lights. And even this can be attributed to people having TVs in their room and watching TVs and falling asleep with TVs, like
Yeah.
really poor sleeping habits. Like there's a lot of people don't realize, but they call it like sleep. What is the word when we sleep grooming, or what is
Oh,
the
yeah.
word when you,
Right.
yeah,
Yeah. Kind of sleep hygiene, sleep grooming. I've
sleep
heard it called.
hygiene,
Yeah.
correct.
Yeah.
There's a lot of caveats to sleep hygiene that we're
Yeah.
changing based on having electronics in our room. The other thing is supplementation. So, supplementation is very effective, but really overdone. And as far as people just supplementing at random. And I have to say that I saw this so much through COVID that it was so stressful because
Mm.
people were wanting any type of resource to help them be safe. So, really qualifying what you're supplementing with. If you're not going to do hormone replacement therapy, every person has an annual physical with their doctor.
Hmm.
And in your annual physical, you can get the most extensive labs during that time with minimal or no cost to you. So if you're going to talk to your provider, just say, at this time, I want to test as many things as I can that will fall under this category. So you can see your testosterone, you can see your thyroid, metabolic panel, lipid panel, because once you have that
Vitamin
data,
D levels. Would you recommend
yeah,
looking at that?
vitamin
Okay.
D, yes. Usually that can be a big part of it. There's a huge culture shifting around vitamin D, C, magnesium, supplementation because it's going to support your immune system. And like I said, there is a difference between a deficiency, normal, and optimal function.
Hmm. Yeah.
So when you get this lab done, I don't think you just supplement based on your symptoms because a lot of people do that. And
Hmm.
a lot of symptoms are what we call multifactorial. For example, fatigue. Fatigue is not diagnostic because that means there's so many other things that it could be caused by than just one thing, right?
Yeah.
So if you
Yeah.
come in and say, I have fatigue, I'm not like, well, that's leprosy. It's over for you.
Send
No,
you to
we
the
have to base
colony.
it. Yeah.
Leprosy.
We have
That's
to
great.
really base it on a bunch of data points, which are your labs.
Mm.
So get your labs annually because you're entitled to those with your insurance. If you
Great
don't
tip.
have insurance, then go to somebody that offers cash pay or cheaper labs and really do your hormones. Get all of them because it's not just testosterone or estrogen. Your thyroid is a big part of it. Vitamin D is a big part of it. B, But the other thing that I really want to encourage people to do is there's a website called examine.com.
Okay.
Okay. This has human studies of the effects of supplementation. So if you think that you want to take vitamin D and you haven't asked anybody and you don't know anything about it, instead of just going to Walmart or Walgreens or Amazon, get on this website and type in the supplement and they will give you ranges to take of this. And then that way you can at least,
Examine.com.
and it's human
Examine.com. Okay.
effects.
Yeah.
Human studies. It's not how animals fared. It shows, and the other thing is it shows optimal dosage, not just normal ranges.
So let me ask you this with examine.com, because that today's the first I'm hearing about this, and I appreciate that resource. I'm excited to go look it up. I find a lot of people want to take a supplement to fix a problem that, as you said, it's multifactorial. There's many different things that play into it. They spend a lot of money. And what I tell several people is, if you are not working with a healthcare practitioner, you can just take your money, instead of going and spending it on those pills, just bypass the middleman and throw your money in the toilet anyway.
I
Because
call
they
it
can be
expensive
beneficial.
urine
Yeah.
for sure.
Yeah. What about, I
But
know we're getting a little bit off track on this question, but the, so supplementation for hormone health is one thing. Many people take a lot of supplements because they get this advertisement that pops up, and the person in the ad has six-pack abs, or they tell you that they have had the greatest sex life of their life recently, or whatever the ad is. But there's something that makes this person say, okay, I'm going to go buy that. Can they look up those types of supplements to look at the efficacy of it?
yeah, this is one reason I like this website is because you have stuff like DHEA, black cohosh,
Yeah.
purifascia, like stuff that actually has really like ton of supplements actually have really good evidence behind them.
Mm.
But the way our FDA is regulating supplements is that it doesn't.
Yes.
So not regulating,
And there's
not
reasons behind
regulating,
that.
yeah,
Yeah.
because it goes into the food category, it goes into the
Right.
beauty category.
Yep.
So
And
really,
because there's a lot of
honestly,
senators who made that bill that got were on the payroll of a lot of these supplement companies. And I know
yeah,
some of them.
there's a lot of political motivations behind this, but
Yes.
once we filter out those, what we can do is begin to consume supplements safely or in
Mm-hmm.
a more educated way. So the
Interesting.
quality of
Yeah.
your supplement and the quality of the concentrated ingredient, if it's the 30th ingredient, it's probably not your friend. It's
Yeah.
probably not the supplement for you. But if you go to examine, um, it really, you can look up zinc because one of the most beneficial sets of supplements are magnesium, zinc, and vitamin D because they support your immune function
Right.
and inhibit that fatigue cycle where you keep getting infected or have that inflammatory response where your immune system is suppressed. But looking on this website will help you consume supplements in a more healthy way.
It's a great
And I
website.
think
I just pulled this up. I mean, this is awesome.
yeah,
I just typed in creatine because creatine's fascinating to me, and probably the most widely studied supplement in the
uh-huh.
performance space. And over 50,000 other studies that this is pulling from, and it's compiling all the information into one simple area. And you've got
Well,
five
then it
studies
says
for
like for
content
yeah,
and
where it
power
says
output
for
26.
myocarditis, it
Yeah.
tells you what they're pertaining to. So you
Yeah.
don't just take
Wow.
creatine because it's for your eyebrows. You look and
Yes.
see.
Yeah. Yeah, look at this. I mean, muscle recovery, cycling performance, warmer, hot weather, which I love this breakdown. I used to subscribe to several journals. Journal of Strength and Conditioning
Uh-huh.
was probably the one that I read the most, and American College of Sports Medicine's journal as well. Those were two of the most fascinating to me. But people would take these little nuanced approach with each one of these research studies, and so I'll have people come in, much as you say that there are a lot of misconceptions out there, and they'll say, well, I read this, that, this supplement does this. I'm like, well, that's probably not the case, but let's look up the actual research and see what it says.
Or it
Because,
does, but it only does for Caucasian males in the United States in the age range of
right.
25 to 27.
Yeah. Yeah.
So it's just applying some information. So pull up one of the links for creatine. The one thing that really helps you with this website is it will give you ratings on the side A, B, C, D
Oh,
for
interesting.
outcomes, fatigue, symptoms. The
Yep.
other thing is a majority of this website is free. Once
Yeah.
you want to
Wow.
get into more nuanced information, you can pay. But for basic information, it is free.
Yeah.
The
Yes.
other thing that's really, really
Fascinating.
important about this is don't, you are not your friend. You're not your brother. You're not your dad.
Yep.
You are you. You have a unique set of circumstances. You have a different metabolism. You eat
Mm.
differently. So taking the same medication, I can't tell you how many patients that will take their husband's medication, their
Oh,
wives, their
wow.
brothers, their sisters. Don't do that.
Yeah.
It's not really, it's not for you. So don't try to take their hormone supplements or supplements anyways.
Well, but the big guy at the gym told me that he takes this amount of this
Right.
particular supplement, and that his doctor is shooting him up with X amount of testosterone. I can't emphasize that point enough. I mean, we are all individual. I had a conversation with a colleague probably an hour before we started this recording, and she said, I've got some questions for you, because one of the things that I know you've always done is you'll do your research and then you'll test stuff out on yourself, because you need to know how it is. And that's really what I have put into practice my entire career in health and fitness. Is I've said, okay, I've read some stuff, I've had conversations with health practitioners. I know that this is probably safe enough to test on me. And when I say test, I literally mean, like, all right, I'm going to
Yeah.
change my bedtime from 10 o'clock to 9:30. And then what will that do? Right. So I'm not taking these crazy risks. But
I
then,
mean, that's how H. pylori was cured. So you
yes,
can
thank
test
you.
sleep changes on
Yeah.
you.
Yeah. And so I literally just test those things out, and I keep a journal for a period of time. My most recent in depth examination on myself was had to do with how a ketogenic or carnivorous type diet would affect the symptoms of ADHD. So when I got diagnosed with ADHD, can't say that I was surprised or shocked by it. But I had read some things, heard some things recently from some top researchers that talked about that ketogenic carnivorous diets can have benefits to mental health. And so I thought, well, okay, that's interesting. I'm going to listen to what they say. I'm going to read what they wrote, and then I'm going to test it out on myself for a short period of time. So I think I went about 9 weeks of eating that way, tested my ketones, kept everything else similar in my lifestyle, and looked at certain markers along the way. And I came out of that test knowing, having a better understanding of how my brain functions on that diet, what works, what doesn't, and then factoring that into my lifestyle of, is that something that I'm going to do the rest of my life long term, based on the results. So I think it's important for people to realize and understand that knowledge from a book, knowledge from a study, knowledge even from a podcast, that's great. But at the end of the day, you've got to ask yourself, how do I then work with somebody who's a health practitioner to test these things out on my body in a very safe way and look at, what is this doing for me? Is this achieving my goals? Am I doing it in a proper and safe way? And just taking mom or dad's or your husband or your wife's pills or powders or whatever it is, that's not going to get you there.
No, and I just think that we live inside of a model that is not preventative.
Yes,
So
100%. Yeah.
I think the hard part is we attribute it to doctors prescribing pills.
Mm-hmm.
And I think we must attribute it to both parties because we have patients coming in asking for pills
Mm-hmm.
for problems that are more behavioral rather than medication based. You know what I mean?
Yeah.
So I think we
Yeah.
have to get into a space, because if you're saying you're willing to test stuff on yourself and try new things, there's a big portion of the population that doesn't want to wait to see how they feel in 2 weeks at taping their mouth,
Right.
a
Right.
month taping
Yeah.
their mouth. So I think like participating in your health and well-being is that you have to participate, and it's your whole life. Because people will come in and tell me, how long am I going to be on this? And you're like, how long do you want to feel better?
Yeah.
How long? What is your long-term goal? What is your short-term goal? Are you trying to do a marathon? Are we really focusing on your cognition? What are we focusing on? Because that's your whole life, and it's more than just me. You have to participate it. I'm one day, I'm maybe 5 days of your whole year. But what are you willing to do to achieve the difference between normal and optimal function?
Great way to put it. Absolutely great way to put it. You've got to show up. You have to participate. This is your life. I'm always fascinated by that conversation of how long do I need to do this? And there's a big mindset shift when you say, this is my life. It's my body. It's my lifestyle. It's my energy. It's my health. It's my vitality. It's my strength. It's my ability to do what I want to do. I was chatting with a client the other day and I said, what do you want to do? And she says, well, I know what I don't want to do. And I said, what's that? She says, I don't want to feel like this the rest of my life because I have a hard time getting up and down on the floor and running around with my son. And I don't want that. I said, okay, so let's flip that. What do you want? She goes, I want to be able to just do whatever. I want to be able to feel great. I want to be. And so we mapped out what that looks like. And I think once you understand what it is that you want and you clearly define that, define what that looks like, you won't ask the question of how long do I need to do this thing? Well, if that thing gets you there, why is that even an issue?
When does
Because,
that thing stop?
right,
Yeah,
yeah. Well, when can I go back to eating the Big Macs? Probably never. Or if you want
I
them,
guess.
eat them once a
Yeah.
year, right? I don't know.
My
Yeah,
favorite
that's
example is
interesting.
I had a patient, her oxygen was at 70. And every day she's like, I'm using less and less oxygen. I really want to wean myself off of this. And I said, weaning yourself off oxygen is death. You
Yeah,
will never be off of oxygen, and your lungs can't do it anymore. So I think for me is, if we take some of these things as serious as they should be, you can make a list of your priorities, and do. And the other thing is, don't change everything in your life at once.
yeah.
I
Oh,
think
great point.
that's the recipe for failure for a lot of people, because it's
Yep,
overwhelming. It's really overwhelming to say, I want to lose 50 pounds. Tomorrow I'm going to wake up at 5 in the morning and I'm going to eat a lettuce sandwich
yep,
and diet ice,
yep,
and then I'm going to run 6 more miles.
yeah.
People have exhaust, and they don't know where they failed. And so they fail all of them.
Yeah, and you can't do everything all at once. And when we're talking about hormone health, one of the worst ways to create a negative cycle and a negative cascade with your hormone health is just stress yourself out a lot more by putting unrealistic expectations. If you want to go all in on something, just pick one thing. I mean, goals are kind of like arms, right? If you've got one arm pulling on something, then you can get some good pull there,
Actually,
right? And you're unique. If you got two, that's probably okay. If you got three, you look kind of weird. And so if you have more than one or two goals in your life, you're probably not going to be able to accomplish anything because you're going in too many different directions. You stress yourself out by having too many goals, you're going to cause this negative cascade in your hormones. And it's going to be worse and worse and worse. But if you just say, hey, I want to address one thing, and then just start to measure what that one thing is, give it some time. I mean, for heaven's sakes, you don't, it's like when you're investing in your retirement, the first 100 that you put in to a mutual fund or stocks or bonds or whatever it is, that doesn't grow very quickly. 20, 30 years later, when you start to see the compounding take effect, that's when you start to see the curve going on more of a vertical path. But it's fairly horizontal for the first 20 or 30 years. The great thing is, when you work with a health practitioner and you start to get a plan in place, you can see some upward movement. You can see some positive results fairly quickly. And then all of a sudden something shifts and the curve starts to go a little bit more vertical. What
I think the
so
other, yeah, that's really good. What were you going to say?
I was just going to say, what? So for people that might feel overwhelmed, because I think that's a fairly common theme, is people don't know what to do, don't know where to turn. If somebody's feeling overwhelmed, they've got low sex drive, or they are thinking that their hormones are off because they've got hot flashes. Where do they start? What is a great starting point for someone?
My old version would say, don't look it up. My new version of me, I think people should Google the crap out of their symptoms.
Okay,
I think they
interesting.
should look them up. I think they should read about it because even misinformation can be powerful if people are participating in their health.
So
That
just the
spark of
activity. Yeah.
interest,
Huh.
yeah, that spark of
Okay.
interest means that they're seeking out health activities, seeking out ways
Mm.
to feel better.
Yep.
Then that means I'm a third or fourth step. You know, you should, the things that you can do for free is to evaluate your lifestyle.
Yeah.
And
Okay.
the biggest components of these, the way to assess your health for free is to evaluate your sleep, your physical activity, and your diet. Those are the biggest components that change our mood, behavior, long term wellness. And that is free. And
Yep.
I would make a realistic diary slash journal for maybe 2 to 4 weeks. And
I would say
people
in
often
that
will,
order too, right?
mm-hmm,
Sleep, activity,
yeah.
diet. Yeah. Okay.
Uh-huh.
I'm with you.
And then when they can start to notice what their real pattern is. And I think the hard thing when I ask people to do this, they view it as a performance or a competition. So
Oh,
writing
interesting.
down the good stuff on, I sleep this many hours and this is why, and I'm so good, but they still don't feel good. So just being honest with yourself and being able to evaluate it,
Mm.
you will get the results. The
Yeah.
results are for you. It has nothing to do with showing me good numbers.
Yeah.
If you come into me and say, I sleep 29 hours a day, it doesn't, you're not winning if you don't feel better.
Yeah.
So
There's no
being
competition.
honest with, yeah, being
Yeah.
honest with yourself and saying, I don't eat well. Because a lot of people that I treat for weight loss, they come in and say, oh, I don't eat that bad. And I just am quite confused because I'm like, hey, if we're in the space of ready to change, we're willing to admit the things that we need support with.
Yeah.
And these are the three things that are free that you can start to support yourself with, and being honest with, okay, my goal this week is to get 9 hours of sleep consistently.
Mm.
I'm not changing my diet and exercise all in one week.
Yep.
Start out with your sleep. Say, I'm going to dedicate myself to 8 or 9 hours. On the weekends, I maybe will sleep longer. Then after that, change, look at your diet. Don't say, okay, I'm never eating a fat again. I'm never eating a cookie again. Stop eating at a certain time and start eating at a certain time.
Mm-hmm.
Do you know what I mean?
Yep. Yep.
Then start to cut things out later. But if you can start to achieve, because your long-term goal is made up of 20,000 little baby goals that you picked every single day.
Yep. Yep.
Yeah. So these are the kind of things that really can change people's life, and they're free.
Yeah. Beautiful way
Do you
to
have,
put it.
yeah.
Yeah, beautiful way to put it. Let me last question. I've got just a couple of other just kind of wrap up questions for you in particular about your own growth and evolution. If somebody goes to a healthcare practitioner like yourself, what are some important questions that they should be asking the practitioner relative to their health so that they become more informed?
Um, so I kind of would like to reiterate the goal.
Okay.
You need to come into this space with the goals of your treatment. This is
Okay.
not just dictated by your provider, because you're not going to be satisfied if you're not participating in it. You won't know why you're not happy. You won't know why you're not getting what you want if you're not there trying to decide what you want. Because when people come into me and are just like, well, I have a low sex drive, well, that's really not the problem.
Mm-hmm.
How is the low sex drive affecting your relationship, your confidence, your social interactions. Are you avoiding social interactions because you can't perform sexually? You're single, you're newly divorced,
Mm,
you're in a 20-year marriage. So being able to talk to your provider about why you need help and what's important to you.
great. So
That,
identify your goal. Be clear on
yeah,
that. And
why you're
sometimes
there.
if you don't
Uh-huh.
know what your goal is, look at what you don't want and then just flip it and say, well, okay, if this is what
Uh-huh.
I don't want, well, what's the reverse of that? And that's an easy way to get to that particular goal. Great, great point.
Um, I think the other thing is look at the practitioner. What are they practicing? How much experience and time?
Mm,
Are they available? Do they have resources? Can they answer your questions? Do you feel confident in their communication skills?
hmm.
This is a long-term relationship. This
Right.
isn't just a pop in, you feel better. There are those places, and that may be the type of environment you want.
Hmm.
But for longevity, you need somebody that's going to be able to talk to you about what's going on with your body. So you understand, so you have buy in.
Yeah, the places where you can just say, hey, pop a pellet in me and go, probably not the best.
Yeah, probably not. But there's some people that like that, and that's okay. It's just not always compatible with long term benefits.
Yeah. Great, great tips for our listeners. Celeste, a couple of last questions for you. Just in your own personal growth and evolution, what's something that you have learned in the last 3 years that excites you the most?
Ooh, that's interesting. Okay. So I just got an ultrasound for my practice.
Okay.
And for a long time, I used ultrasound to um, inject and stuff like that, joints, to do joint aspiration and joint injections. And now
Yeah.
I'm using it, ultrasound in a different way, and just realizing how much growth there is to be able to see when you're putting a needle in someone's body, the depth, the level. I think it's been like really eye opening because people, I teach people this and then I'm learning it on a whole nother level and saying, okay, some of the stuff that we have believed is different than it appears with actual video imaging.
Wow.
So I think for me, like, I also practice aesthetic medicine. It's not very respected, and to evolve it into more of a medical practice
Hmm.
rather than just something that's cutesy or people think is fun, to really teach people this is medicine
Yeah.
and partaking of it has risks. So I think for me, I really um, that was has been really fascinating and changed the way I practice entirely.
Very cool. Yeah, and
Yeah,
I agree. I mean, aesthetic medicine, cutesy, or people may say, well, it's just vanity, and
they
I don't.
devalue it.
Yeah, I don't agree with that. I think that there's so much to it that helps people literally change their life in a. I hate to say in a short period of time, relatively short period of time. There can be some pretty fascinating, life changing things there. Um,
Well, and that tie between your mind, so the way you feel about yourself and the way perceive you when there's congruency.
yeah,
So a
for
lot of
sure.
things with hormones, when people age, when someone is 40 and 50 and 60, they still feel like the 20-year-old version of themselves.
Yeah,
So
yeah,
I think that's why hormones really help people to restore the way they felt before and bring back that cognition, the confidence, the social support that they have in their lives to be able to feel like they're participating and feel normal.
yeah, yeah. I was at the gym earlier talking to a friend of mine, and I said, I look around and I think to myself, yeah, I'm still in my 20s. Now, my body doesn't always tell me that, but I still feel the same way, especially
Right.
when there's the
Yeah.
same
You
faces
still
that
have,
we see from 20, 30 years ago, right?
yeah. Yeah, I agree. So
So
I
Les,
think
what
that
is,
that's,
oh, yeah, sorry, go ahead.
no, I just think that's a really positive thing because we often dismiss people for the age they occupy. We dismiss their feelings as not as
Mm,
valid.
yeah, yeah,
And I think this helps people to feel the way that they think they perceive themselves. You know what I
yeah,
mean? Hormones that they're like, oh, my brain is clear. I feel better.
yeah,
Like it's so neat to be on the other end of someone saying thank you.
I think a lot of people that I've heard, they just say they feel more like themselves. So it's almost like a
Exactly.
returning to who they are. Yeah.
Yeah.
Last question for you. What is something that as you've evolved that you used to believe that you no longer do?
I think honestly, when people say for someone to eat less and move more, and
Mm-hmm.
then they will be healthy and they will lose weight.
Mm,
When I was younger and not a provider, I thought that was true.
mm-hmm.
And then I run into patients that actually eat clean and they work out all the time and they have PCOS or
Yep.
insulin resistance.
Yep.
And I think for me, just realizing how much genetic variability and how many other factors play into people's long term health
Yeah.
than just their diet and exercise. That doesn't just change your whole life.
No, and that is really just like that's one component of it. So it's a much more nuanced approach. Well, and on that note, folks, it is time for us to wrap up another episode of the Evolve podcast. I want to thank our guest, Celeste Hicken, for joining us today. Celeste, you're always learning, growing, and evolving. What is the best way for people to follow you? And if they have questions about hormones or any of the aesthetic services that you provide, how do they get in touch with you?
Oh, um, you can find our website. It's called Inspire Medical Spa, or you can message me on Instagram through CO2 Celeste. And you can ask any questions and we can set up a consult just to talk about your goals and what you're looking for.
Great. Yeah, we will link those in the show notes, folks. Celeste Hicken, thanks again for coming on. Great to see you and great to have this conversation today. Hey, remember, guys, that it does take time and consistency to evolve, but first you have to disrupt. And now it's time for you to get out there and evolve. Thank you for listening to this episode of the Evolve Podcast. Follow us on your favorite podcast app, and if you haven't done so, please give us a rating. As an independent podcast, it really helps us get more reach. This podcast is part of our mission to help millions of people evolve into the best versions of themselves. Please check out our coaching services at evolve-cast.com or pick up some of our Evolve merch. Until next time, keep evolving.